Medicare. What does it do for you? Well, if you're younger than the age of 65, then probably nothing. Medicare is the federal health insurance program for people aged 65 and older. Some people may have Medicare if they're younger, but they have to be disabled. Medicare has 4 different parts, A through D, all of which covers different things. Part A covers hospital insurance, B, medical insurance, C, Medicare Advantage plans, and D is prescription drug coverage. Now, I believe Medicare is a admirable government program, but there are major issues with this program. The number one is the expenses, and there's many minor issues to solving these problems. Our first issue with the cost of Medicare is the fact that these older folks just won't die nowadays. According to the Department of Health and Human Services, people are living longer due to reduced stress, lower amounts of environmental pollution, better medical technologies, and better nutrition diets. The sum results of these factors are keeping the old folks alive.
There are many scams involving Medicare where people in the government lose money by crooks in their schemes. One example is crooks target elderly people and trick them into sharing their personal information such as social security numbers, home address, and their date of birth. Once that has been done, they basically have control over that person and their financials. According to Stop Medicare Fraud, it is estimated that between $60 and $90 billion is lost each year due to Medicare fraud. Medicare scammers are also attack bank accounts in which they ask for the last 4 digits of your account in return for medical equipment. Right away, one should draw red flags immediately because of 1, Medicare will never call you for your personal information, and 2, no one should certainly not ask for your account number. These scammers can be very aggressive, often calling many times at all hours of the day to wear down potential victims, and can be convincing. Nation Association of Medicaid Fraud recommends the following tips to avoid being scammed. Never give out personal information over the phone, especially if it is from an unsolicited caller. If consumers receive a suspicious phone call, they should hang up immediately. Remind elderly family members that Medicare will never call for sensitive personal financial information. If you suspect fraud, contact your local police or Health and Human Services operation. Don't do business with door-to-door telephone salespeople who tell you that medical services or equipment are free. It's never free. Medicare, Medicaid, and Social Security Administration will not call you to update your information or issue a new card. Give your insurance or Medicare identification only to those who have provided you with medical services. Keep accurate records of all health care appointments to prevent fraud involving Medicare, Medicaid, information provided to doctors or caregivers.
Another major problem for the Medicare program is the expense of chronic illness. 7 out of 10 deaths are from a chronic illness, and only 27 states have programs in place to reduce the costs. According to Kimberly Schwartz, there are 7 most common chronic illnesses, and those are Alzheimer's, stroke, diabetes, end-stage renal disease, lung disease, heart disease, and cancer. It is projected in 2015, $189 billion will be spent on Alzheimer's alone. In 2008, $6.5 billion was spent on strokes. $92 billion a year is estimated to be spent on the cost of diabetes. $23 billion a year is spent on end-stage renal disease. Roughly $8 billion was spent in 2006 on respiratory and lung problems. In 2009, heart costs were up to $183 billion. And for inpatient cancer care, it is $7.3 billion, and that does not include the Part B prescription plan that is even a higher cost on that. Some of the programs that can keep costs down, according to Health Prevention, there is an evidence-based disease disability prevention program which empowers older persons to adopt healthy behavior, improve health status, and manage their conditions better once they are diagnosed with an illness. There is the Hispanic Elders Program, which helps Hispanics get helpful information about benefits and possible programs to help with this illness, because Hispanics are the leading minority group suffering from diabetes. Diabetes Self-Management Group is a proper training and knowledge of how to handle diabetes, maintain and control it to prevent it from getting any worse. 1 of every 2 Americans suffers from at least one chronic disease. Obesity and alcoholism are preventable illnesses but are slowly becoming top common chronic illnesses.
The final part to the reason why Medicare is so expensive is due to doctors opting out of Medicare and not looking after patients. There are 3 groups of doctors. There are doctors that accept Medicare and the reimbursement rate. The second group is doctors that accept Medicare but charge up to 10% more than what Medicare covers. And the last group of doctors doesn't take Medicare at all. Now, you might be asking yourself why these doctors would opt out. According to Wall Street Journal columnist Melinda Beck, the 2 main reasons why doctors opt out is that the reimbursement rates for Medicare is too low, and also that doctors and medical practices would like to avoid government involvement. According to the American Medical Association president, Dr. Artis Hoven, the Medicare reimbursement rate has stayed flat, but the cost for practicing medicine has increased by 20%. Forbes contributor and Institute for Policy Innovation scholar Merrill Matthews says that a 24% cut in the Medicare reimbursement rate would happen due to sustainable growth rate policy. A September 2013 New York Times article titled "Doctors and Their Medicare Patients" states that Medicare is too big of an insurer for medical practices to ignore. And one doctor said that people don't care about doctor proficiency. They care about what offices will take their Medicare and take their insurance. And as for government involvement, a lot of doctors state that they don't like how they can't practice how they like, because if they offer things like reduced payments for people with cancer or other diseases, or $5 off for preachers or policemen or firefighters, that counts as a legal enticement as the government, and they can be in trouble federally with that. In summary, doctors may charge more, or they may opt out of Medicare due to government involvement and poor reimbursement rates.